This lecture is going to be on deep vein thrombosis. The epidemiology is that it occurs 1 out of 1,000 people annually in adult populations. There's a sharp increase after age 45. The hospitalization, immobility, trauma, pregnancy, obesity, hypercoagulation disorders have been linked with increased risk of DVT. Recent paralysis and paresis, or cast immobilizations to the lower extremity, are also linked with DVT. Bedridden for greater than 3 days or major surgery requiring general or regional anesthesia, active cancer, receiving treatment within 6 months, or currently receiving palliative treatment. And then a previously documented DVT is also associated with a future DVT. So the subjective findings are going to be leg warmth and leg pain. We're also going to see calf tenderness, and it might just be asymptomatic or it's localized tenderness of the deep venous system.
All right. Hi, Austin. My name's Christian. I'll be your student physical therapist today. So, did you ride your motorcycle here?
Yeah, but I just my head gets really cold a lot. So.
Okay, that makes sense. Okay. All right. So, what brings you in today?
Well, you know, I had some problems with cancer earlier, and then I like fell down the steps and I hurt my leg and I was immobilized for a while because I broke my ankle, so I had a cast. So basically, they took it off, and then I don't know. Ever since, it's just been a little swollen, and a little tender.
Okay. All right. And so, how long ago did you get your cast taken off?
Probably like 3 to 4 days ago.
Okay, gotcha. And so, when did you start to notice the swelling, though?
Honestly, when I was walking around, it kind of just felt a little painful.
Okay.
And whenever I would like go and touch it, and like sometimes I can't really see my legs just because of all the excess weight the doc told me to try to get rid of.
Yeah.
But yeah, I would just look down and it was just all swollen, and I would try to touch it and it felt really painful there.
Gotcha. And so with your cancer, so how long has that been going on?
A couple of years now, just on and off.
Okay. Are you getting treatment for it now?
Yeah, currently getting a little bit of treatment for it.
Okay. All right. And is what type of cancer is it?
It's a prostate.
Okay. And is the treatment going well? Is it under control for the most part?
Yeah, like right now they say the levels are undetectable.
Okay, that's good to hear.
But yeah, if they ever rise above that, then I'll just start getting some kind of treatment again.
Okay. And so how would you rate your pain levels with your ankle?
Probably when I touch it, like a 5 out of 10.
Okay. And so is that pretty constant, or is there pain at rest or anything? Like, what's it get at its best?
At its best, when I'm resting, I don't know, it get to like a 3 or 4.
Okay.
But it still just kind of hurts.
Okay. And is 5 out of 10 the worst it gets, or does it get worse than that sometimes?
Whenever I'm reaching up in my shelf, because I always keep my bananas up on the shelf and I try to just reach for them, that's when it really hurts. But
gotcha. All right. And so that makes it worse. Is there anything that makes it better?
Just forgetting about it, resting, watching TV.
Okay, gotcha. So do you like to lay around a little bit?
Yeah.
Gotcha.
Doctor said that's why I've been having some trouble with the weight.
Yeah, definitely. I know breaking an ankle is kind of a barrier to that as well. So.
Yeah.
Let's see. All right. So,
No, I feel like you're good.
okay, Austin, I have just one quick question for you. One more thing I wanted to check on. So, have you ever heard of like a deep vein thrombosis or DVT? Does that ring a bell at all?
No.
Okay. Okay, so I just wanted to see if you've ever heard of that, if you've ever had one of those before. Okay, so now, do you have any questions for me before we get started looking at the leg?
Can we take a quick break? I'm kind of hungry for bananas.
Sure, we can do that.
Your objective findings for a DVT would be asymmetrical swelling of at least 3 centimeters or greater than the asymptomatic side. Also, entire leg swelling, pitting edema confined to the symptomatic leg, collateral superficial veins, non-varicose, and then venous ulcers and erythema. And some of the key diagnostic features would be the Wells criteria and then the diagnostic imaging with ultrasound.
Okay, Austin, so I just want to check out the leg here. So it does look like you got a good bit of swelling in there. So it looks like it's kind of blown up a little bit. And it's a little bit red, and and I don't see that on your other leg. Is it tender back here?
Yeah.
Okay. And is that kind of like the symptoms you've been having?
Mm-hmm.
Okay. Yeah. Okay. And you've also, I can see like some of the veins are really sticking out on this leg, which seems a little bit odd to me.
Yeah.
And so I'm just going to do a quick measurement here. And so I just want to compare the circumference of your calf. Okay. So that side is about 35 centimeters. Then this side. And you can bring it back down. Is that okay? Okay, so this side is about 52 centimeters. So this leg is a lot more swollen than the other one. And so I think I've kind of got an idea what's going on. So I'll talk to you in a second.
Mechanism of symptoms are mechanical and inflammatory nociceptive pain. DVT formation is commonly a result of 3 interrelated factors, and that's venous stasis, vascular or endothelial injury, and hypercoagulability. The occlusions of blood flow leads to swelling, pain, and redness in affected limb distal to the site of the blockage, primarily as a result of inflammatory mediators. If we ask ourselves, do we treat or refer, this would be an emergent referral to an emergency room in a direct access setting. And then it's emergent referral back to referring physician or surgeon if applicable. The example treatment for a patient with DVT would end up being anticoagulants like heparin and warfarin, and then thrombolytics, and then inferior vena cava filters.
Okay, Austin. So off of just kind of hearing about how your leg was recently in a cast, so you had some recent injury to it and everything as well, but nothing that brought on, no injury to the leg that's recent to explain your symptoms. And just given that it's super swollen, really red, and pretty tender, and so that would lead me to think that you may have what we call a deep vein thrombosis. And so I can't make that diagnosis here, but that is something that's potentially life-threatening because that clot can break loose and get lodged in your lungs. And at that point, it gets really dangerous. And so before I did want to check with you, are you having any shortness of breath, anything like that right now? Okay, good to know. But this is just something that we do want to get checked out. And so I think if possible, we want you to go to the emergency room just to make sure that if that is what's going on, that you can get this treated like ASAP. Does that sound okay with you?
Yeah, but can't you just massage it and make it better?
So this is just something, like this is potentially life-threatening, and so we just want to rule anything out and make sure that you're okay before we do anything like that. Because honestly, the massage could even help break the clot loose if that's what's going on.
Okay.
So this is something you want to get taken care of as soon as you can.
Okay.
All right.
I'll go get it taken care of.
All right. Sweet. Thank you.